All right, thanks, Steve, and thanks for having me here. So as you mentioned, I'm going to talk about product certification, and specifically I'm going to be focusing on products that might be used on private wells. So treatment products like point of use, point of entry, filters, RO systems, things like that. So before I begin, I just want to talk a little bit about WQA and who we are and what we do so you understand the perspective from which I'm speaking. This is our mission statement. One of the things I want to stress on this is the science-based decision making. This is a very strong core value of WQA. It starts all the way up at our board level, and our executive director drills this into every staff member. So everything that we do is really tainted by science-based decision-making. In terms of programs and services that we offer, it's typical of what you might expect from an organization like WQA. We represent the residential, commercial, and industrial drinking water treatment industry. We have about 2,500 member companies. We do get involved with the product certification, of course, which is what I'm going to talk about today. We also offer education and professional certification. We host a couple of annual events, and we get involved with government affairs and technical affairs which impact the industry. And I also serve as the scientific consultant for the Water Quality Research Foundation, which is a separate organization, has separate governance, separate funding. And also I want to mention that we do offer a number of free resources for public officials and code writers, decision makers like yourself, and this slide just shows you how you can find those materials. For example, we have the water treatment for dummies. We have pamphlets on various contaminants like lead, and I have some of those with me if you want to see me at the break, and I'd be happy to share them with you. But this just shows you how you can find them on our website as well. The Gold Seal program is really what I want to talk about today. So the Gold Seal program is what we call our product certification program. It started in 1959 because the industry came to us and they said, look, there's all these manufacturers out there. They're making claims which are confusing for consumers. Some of them are misleading claims. Some of them might be correct, but we don't know because they're not being independently tested. And we need WQA to get involved and try to tame try to rein this in. And how do we do that? We do that through development of product standards and then independent certification of those products. So we first wrote the standards which are used for evaluating all of these point of use and point of entry products. We started with one that was called WQA S100, which was for softeners, and then we moved on and developed standards for filters and ROs and other stuff. And in 1985, we turned all of those standards over to NSF International. And you have to understand, at this time, WQA was trying to get out of the standards development and the certification process. We were hoping that we could turn it over to NSF. NSF and others would pick up where we left off. It didn't work out very well for us and for the industry and for the consumers. So we ended up having to get back involved in 1995. So why didn't it work out well? This slide shows you a cost comparison of what happened with the certification process. And admittedly here, the only reason I can share this with you is because these prices are completely outdated. So you can't go to WQA or NSF and get these prices today. But this is an apples to apples comparison. So this is a comparison of the same softener at both laboratories. And you can see that the pricing in 1990, when we were trying to get out of this and get away from certification, had gotten out of control. What we had inadvertently done with the best of intentions, we were driving everybody to NSF. We had created a monopoly, and whenever there's a monopoly, prices go through the roof. So it was really harming consumers because all of these costs are ultimately passed on to the consumer. So that's why in 1995, the board asked us to get back involved in this process. And so we reinvigorated our process in 1995 in order to drive competition, because through competition you get better pricing, better speed, and that keeps the cost down to consumers. So the bottom line here is the reason we got involved in all this in the first place was to protect the consumers. And it's through this development of standards and then independent testing that we were able to do that. So let's talk a little bit about standards versus certification bodies. As I mentioned, we had turned all of this over to NSF in 1985, all of the standards. But what really isn't a standard? We call them ANSI standards because they've been adopted by the American National Standards Institute as standards for North America. They're established through a consensus process. They provide minimum requirements for safety, performance, things like that. And certification bodies are then accredited to evaluate products against these standards. An important thing to know about ANSI standards is that they must be made available for everyone to use. So even though these are branded as NSF standards, everybody can use them. And that's why we are able to get back involved with the certification process. So how were these standards developed? Essentially, this slide shows the development process, but in the interest of time, I'm going to skip through it fairly quickly. The main points here is that a problem is identified, and then you get a committee together. The committee must be a balanced committee, so it has to involve regulatory folks, public health officials in this case, and it can't just be a number of industry members getting together to decide what's in the standard. And then it also has to go out for public review. And so then the public review comments also must be dealt with by the committee. So it's a very time-consuming process. It's a very rigorous process. And in the end, you end up with very rigorous standards. And let's go back to the certification bodies for a minute. So on overseeing all of this, there are what we call the accreditation bodies, which are the American National Standards Institute and the Standards Council of Canada. So they oversee the process of standard development, but they also accredit the certification bodies. So there are specific ISO rules that we must follow when we evaluate a product against a standard. And this slide just shows you some of those ISO rules. But the point here, the takeaway that I want you to have is that there is these organizations over the whole process, and they oversee not only the standard development process to make sure it's fair, but they also oversee the certification bodies to make sure that we are all evaluating these products fairly to the same standards. So who are the certification bodies that we're talking about here for water treatment products that you might encounter in the private well industry? There's the Water Quality Association, there's NSF International, there's Underwriter Laboratories, and as I'm listing these here, you can see the seals along the bottom. So the way that you identify certified products is that seal will be on the packaging or the product itself. So the seals there are listed in the same order as the certification bodies. So you can see WQA's at the left, and then NSF, and then UL seal, and on. But that's who the accredited certification bodies are who would deal with products that are in the private well industry. This next slide just shows you kind of this tree shows you all the different standards, some of the common standards, I should say, that impact products that are used on private wells. And I wanted to throw this up here because it can get very confusing. So, for example, on this tree, there are 3 standards which deal with filters. 42 deals with filters that are making aesthetic claims. So a filter that would remove chlorine would have a certification of 42. A filter that would have a health claim, like say it removes lead, would be under 53. And then there's also 401 at the bottom. So a filter that would claim to remove pharmaceuticals could be certified to 401. So it can get very confusing, and there are unfortunately new standard development organizations entering this realm. So I think it's going to get more confusing in the future. If you are ever confused by this, just reach out to WQA or myself. We'll be happy to walk you through which standards will be applicable for the products you're looking at. So what product requirements are covered by these standards? Again, back to the point of my talk, I want to make sure you understand how product certification benefits the consumer. So these are the 4 main topics that I want to talk about, which are in the standards: material safety, performance, structural integrity, and literature. And how do we evaluate those products against those requirements. Well, we call that conformity assessment, and that gets back to those ISO rules that we were talking about. And it starts with a disclosure of the confidential bill of materials, the formulations, the suppliers, the wetted surface areas, their manufacturing locations, their manufacturing processes. This is really everything proprietary about that product. There's a lot of trust here involved. So the manufacturers have to really trust the certification body to disclose all this information, and we are charged with a big responsibility of keeping that information confidential. So because that is the everything you need to know to build that product. And then, of course, it involves product testing and literature review and factory audits, which are very important. So I'm going to talk about each of those in a little bit more detail. The material safety testing, here we're looking for things that might leach out of the product, which would be harmful. So products are exposed to multiple pHs, and the exposure is always based on worst case scenarios. And again, this goes back to those committees who are developing these standards. They look at the worst case way to challenge these products. A toxicologist will review the product formulation that we talked about, all that information about how the product is made, and determine what we're going to test for. And there will typically be hundreds of different chemicals that we are testing for in a particular product. And then the pass-fail thresholds for these products are always either at or below the US EPA MCL. So in this case, you can see we're evaluating lead here down to 5, even though the action level is 15. The structural integrity testing is designed to determine if the product is going to cause any leaks. There's 2 main tests that are involved with this, the hydrostatic pressure testing and the cyclic pressure testing. The hydrostatic pressure testing is going to be done at 3 times the maximum working pressure or 300 psi, whichever is worst case. So if you're a manufacturer, normal line pressure is 50 psi or around there. If you say my product is rated for 60 psi, okay, so 3 times 60 is 180. That means 300 is worst case. I'm going to test it at 300 psi, even though your product is only rated for 60. So it's very much worst case. With the cyclic testing, it's 100,000 cycles of pressure spikes that go from 0 to either 150 psi or from 0 to your max working pressure, whichever is worst case. So again, if your product is rated for 60, it's going to be hit with 100,000 cycles from 0 to 150 psi, because that's worst case. Performance testing, this is an example here of lead testing. Just a couple of things that I want to point out about the performance testing. Again, it's always designed to be worst case. In this case, there was 2 test units that were done. There's always 2 or 3 test units for these different tests. And there's various ways we can get those test units. One of the common ways is during our factory audit, we can come to your factory, tag samples that are coming off the line and say, I want to test that filter and I want to test that one. And then we'll tag them, send them back to our lab for testing. This particular test, this particular product actually was rated to go to 120 gallons. So you can see that we tested it to 144. So for filters, we always go beyond the capacity. In this case, this is a filter that has one of those little lights that tells you it's time to change the filter cartridge. So therefore, we only went to 120% of the capacity. If it was a filter that didn't have that little performance indicating light, which tells you it's time to change the filter, then we would have gone to 200% of the capacity. So filters are tested way beyond their capacity. It's done again at multiple pHs. This test report here shows the pH 6.5 testing, but again, we look at which pHs would be worst case for any particular contaminant. And we look at criteria the pass-fail criteria is either going to be at or below, again, US EPA MCLs. In this case, lead is evaluated to 10, but the action level is 15. Right now, there's actually a proposal on the table to lower the requirements in the standard to 5. So lead will probably be evaluated to 5 in the future. But right now, for this one, it was 10. Literature review. During the literature review, what we're really looking for is that the manufacturer needs to provide information to the consumer that's important for use. So any information about maintenance, how often to change the filter, things like that need to be included in their literature. And then, of course, the facility audit. So what we're looking for in the facility audits, first of all, if you go back to our process, our conformity assessment process, you had to disclose every factory at which this was built. So you may build this product at 3 different factories. One's in the US, one's in Canada, one's in China. We're going to audit all 3 of those factories on a routine basis. And we're going to be looking for manufacturing creep. We're going to be looking at how you said you make the product, who you said your suppliers are, making sure that those are actually your suppliers and that's actually how you make the product. We'll look at your quality control checks. We'll look at your quality systems, and we'll look for sources of contamination and things like that. So the factory audits are really a big component of the certification. Bottom line then, the importance of testing and certification is that it provides this peace of mind for consumers. So you have this third-party evaluation that the product is going to perform as advertised. So if this provides value for consumers, then products must fail, right? So this is a evaluation of the failure rate, the overall failure rate across all the certification bodies, and we've gotten together and compared this many different times. It's roughly 20%. So across all of the different certification bodies of the products we test, roughly 20% of them will fail. And what happens when a product fails is the manufacturer's got to go back to the drawing board, redesign that product, and then come back for retesting before they send it out to market. So I also looked at, if there was any patterns in our failure rate, and this was admittedly a small sample set, but most of the failures here were for material safety. There were also structural integrity failures and, of course, performance failures. And there was a wide variety of products that are covered in this failure. So there's not really any clear patterns here. They can fail for lots of different reasons. And I also included in the slides here just some examples of failures so you can see what I'm talking about. This first one here was a product that was supposed to remove lead. You can see it started to break through right away. Didn't make it very far into the test. This one is a structural integrity failure. It says it failed after 58,000 cycles. But you have to understand the way we do this test is it's an automated process. So you hook it up to a system that's going to hit it with those 100,000 spikes, and then you leave it run overnight. You come in the next day, and the lab's flooded, and you say, okay, well, it failed at some point. There's 58,000 cycles that are done, so I'm going to say it failed somewhere before 58,000. So extraction failures, these are, again, when I say extraction, it's back to that material safety. So we're looking for what might leach out of the product. In this case, this was a failure for 1,2-dichloroethane that was leaching out of the product. It's a very common solvent. It could have been picked up by one of their suppliers, used for something else. It could have actually been used at some point in the manufacturing of this product. Who knows? But for whatever reason, this product was leaching that chemical. They would have to go back to the drawing board then and figure out where it was coming from, perform corrective action, eliminate the source before they could get it retested. And this one was chromium, a failure for chromium. So this product was at an alarming amount of chromium coming out of it. And chromium it can be a common contaminant in other things that you use. So maybe you didn't intend to have chromium in your product, but it's a contaminant in some other chemical that you're using. So bottom line here, let's talk about compliance. So you will see some manufacturers, again, if you go back to our talk about the standards have to be available for everyone to use, that also means that manufacturers can self-comply. So manufacturers can take their own product, they could either do independent testing or they could on their own, in their own lab, evaluate their product. And so sometimes you will see in advertisements, my product complies with 53. What does that mean? It means that they have self-determined compliance. And some of the manufacturers do a great job with that. The difference, though, that I want you to understand is this is the difference between that. So it's essentially self-compliance. It doesn't necessarily involve independent third-party verification to assure the evaluation, how the evaluation was done. There isn't any periodic retesting that's required. There's no independent factory audits being done. So you just need to understand that it's a self-compliance. It's not a third-party compliant statement. And then I don't want to completely scare you away from non-certified products, because you have to understand that certification is not always possible. There are many cases where manufacturers don't have the option to go out and get certification. A good example here, Virginia was just talking about PFAS. We did the first testing with Minnesota Department of Public Health for products that remove PFAS back in 2008. And it took over 10 years. It was only this year that testing protocol actually got written into an ANSI standard. So, I mean, it can take a long time for this standard development process to work. So during that whole time, nobody could have gone out and gotten that independent certification to an ANSI standard, because there simply wasn't any. The only option people had was independent testing. And a lot of manufacturers were doing that type of independent testing. So that you see that with emerging contaminants, you see that with emerging technologies. This slide here says high volume technologies as well. Maybe a better word there would have been high capacity, high flow rate technologies. You know, if your product is so large, it can treat so much water, that it would take me several years to challenge it to a very rigorous level, or it might take me a water tower. Well, then chances are there's no standard that exists to do that. So you're going to have to do independent testing. So just wanted to make you aware that those cases exist. And then this slide just shows you some of my favorite non-certified claims. Like, I'll let you read through these as I go ahead and take questions.
Do you want to pull up Slido? What did I do wrong? For some reason, it's not showing up on my phone. There we go. Okay, so go into your, let's just go through them where they are here. What do you recommend for treatment when there's no certification standard? You kind of answered that, I think, just now.
Well, we tell consumers, first of all, we let them know there is no standard. So you're not going to find certification, because it's an important thing for consumers to know. If they're looking for certification and they can't find it because there is no standard, they need to understand that. So that's the first thing we tell them. And we also tell them to ask the manufacturer for independent testing. You know, a lot of these manufacturers, especially the ones who are seeking certification, before there's a standard published, they will be going out and getting that independent testing, because they want to understand how their products work.
So the next question is, what about products that occasionally have a lemon? I mean, it's like anything else. The car can be a lemon, right?
That is I'm glad somebody brought that up. So if you ever run into those types of products, so we often hear, you know, researchers were studying this or that, and they found a certified product that didn't perform as advertised. The first thing you should do is contact this certification body, the organization that certified that product, because there is a complaint process that is required for all of us. So whether it's NSF, whether it's WQA, whether it's UL or IAPMO, we have a complaint process. If you let us know, then we will go back through and we'll do factory audits, try to figure out how that happened and correct the situation. But if you never let the certification body know, then it probably won't be dealt with, and there could be other lemons. We do those routine factory audits, though, so we are trying to catch that with factory audits. We also do retesting, so we're retesting random products to make sure that there isn't manufacturing creep, and hopefully we would catch those cases like that, and then the manufacturer will have to correct it.
So have you ever encountered a treatment company selling non-certified systems who claim that advising homeowners to ask for certification was persecution or anti-small business?
No.
And so what I could tell you about for the private well class is that we tell folks that you need to have certification, because that's the only way to be sure. There's too much money to be made in treatment, that if you have someone who's claiming things but they're not willing to get it certified, you know, there's too much stuff out there that's just doesn't meet. All you have to do is go onto a website for a company that sells all kinds of treatment equipment, and they list their certified and their non-certified equipment, and the price is about 3 times different. And so That's my take on it as someone who's not a treatment professional.
So to add to that a little bit, I would say that we do feel strongly that there needs to be competition in the certification market. And again, that gets back to why we were asked to reinvigorate our program. If you have a market where there is a lack of competition there, the prices will get out of control. And ultimately, the people who are harmed there is the consumer, because all those costs get passed on to the consumer.
Okay, so can consumers contact WQA directly for advice on addressing a contaminant, or what would you recommend?
Yes, we do take consumer calls. We get a lot of consumer calls, actually. We direct them to the various organizations that provide certification. All of those organizations that I listed have a website where consumers can search for products, for example, that remove lead, or products that remove PFAS, or products that remove arsenic, so you can actually claim or search for the claims that you want.
Okay, I think we're going to move on, and so the rest of these questions we'll get to you like we've done with.
Thanks.
Yeah, thank you very much. All right, thank you.